Hi there, everyone. Today I'm going to go over the adrenal thyroid connection because so many of my patients come into the clinic complaining of thyroid symptoms, right? Symptoms of fatigue, of weight gain, of feeling sluggish, post-exertional malaise, trouble recovering from exercise. And yet, when we check their thyroid, it looks pretty normal, or sometimes it looks a little bit low or hypo, but they do not have thyroid antibodies. So in the case of the patient who does not have thyroid antibodies, they do not have Hashimoto's, but they do have some low levels of thyroid hormone or even normal thyroid, but they have symptoms of low thyroid. It's really important that we also look at the adrenals. So I'm just going to share my screen. And my name is Kate Godley, and I'm the owner of the Functional Medicine Center in Durham, North Carolina. If this information helps you, please see our website, thefunctionalmedicinecenter.org, for more information, and there's instructions there on how to become a patient. Okay, so number one is that the thyroid is a butterfly-shaped gland in the neck. It sits right in the front of the neck, and you can actually feel the two sides of the butterfly if you press gently. It makes thyroid hormone, and the body converts thyroid hormone, which we call T4, because it contains 4 iodine molecules. It converts this to T3, which is our active thyroid hormone. We're going to come back to that in a moment. The thyroid hormone affects everything. It affects our energy level, the clarity of our thought, our memory, working memory, executive function, how alert we are, if our skin is dry or oily. Most people with low thyroid will have dry skin, libido or sex drive, our ability to have a bowel movement, how hungry we are, our metabolism, our heart rate, and even our mood. So sometimes patients are diagnosed with depression, and if no one has checked a thyroid panel on these patients, it's really not appropriate to give someone antidepressants until you've tested their thyroid. Thyroid really does affect everything. The conventional treatment for hypo or autoimmune hypothyroid, also called Hashimoto's, is replace the hormone. Use Synthroid, which is synthetic, or Armour in some cases, which is desiccated pig thyroid. WP Throid is not available anymore, but Nature Throid, and neither is Nature Throid, but NP Thyroid is also available. So there's NP Thyroid and Armour available. There's also, these are called natural desiccated thyroids because they are pig thyroid, which contain T4 and T3. There's also Cytomel, which is just T3, which is synthetic T3. There's also compounded combinations of synthetic T4 and T3. And we can also make these more of an extended release formulation. So really, it's not a one-size-fits-all. I have close to 200 patients taking thyroid medication, and they are all on a different combination of different medications or thyroid hormone. Also, people's doses change frequently. If you're listening to symptoms and you are testing people's thyroid levels as the clinician, then you know that you need to change their dose. Throughout the year, their dose will go up and down. When I see someone and they've been on 100 micrograms of Synthroid for 20 years and they're upset that they need to change their dose, I try to remind them of this, that it's not a bad thing. It's the way the body works because of this interaction with the thyroid and the ovaries and the adrenal glands, which we're about to talk about. So conventional treatment for high thyroid or overactive thyroid, autoimmune version is known as Graves' disease, is to use radioactive iodine, which slowly destroys part of the thyroid permanently, or to use these chemo medications that really do kill the thyroid. So the problem is that these block the absorption of iodine, and what happens then is that you have an iodine deficient patient, and they may, because we haven't addressed the underlying cause of the autoimmunity, they may have a relapse of hyperthyroidism over time. Patients also can present with symptoms of both hypo and hyper, and they can have autoantibodies for both hyper and hypo, which we'll get back to in a minute. So this is just kind of how these medications work. The PTU actually blocks the conversion of T4 storage to T3 active thyroid hormone. There's also medication to treat the symptoms if you have hyperthyroidism. Beta blockers do address some of the symptoms. The racing heart is helped with beta blockers, the elevated blood pressure. There's also surgery to partially remove some of the thyroid lobe to try to help with the symptoms. L-carnitine is another sort of outside the box way to address hyperthyroidism or Graves. A low iodine diet, which means no cheese or conventional cheeses where they're adding iodine salt. Bugleweed is another way to treat hyper or Graves, and it also blocks the absorption of iodine into the thyroid. Selenium and lemon balm. Those are also, I use combinations of all of these treatments when I have a patient with Graves. But the number one thing is we also look at gut healing and we look at the health of the rest of the endocrine system, which we're going to talk about in a moment. Patients with thyroid disease, patients who present and they already have Hashimoto's or Graves' disease, they definitely need a full workup. So we need to look at DHEA coming from the adrenal glands, cortisol also coming from the adrenal glands from the outside or the cortex of the adrenals, total iron, selenium RBC, which is red blood cell selenium, magnesium RBC, plasma iodine for obvious reasons because thyroid hormone is made from iodine, copper, as well as zinc, and then ceruloplasmin. And you can look at both zinc plasma and RBC, which is kind of tricky right now to get LabCorp to do both of those. I'll just make sure my phone's on silent. And then root cause testing. So this is really where we hone in, especially after the patient is stable. We talk through a stool analysis. What is a comprehensive stool analysis? It is when I see all the digestive particles in the stool because they've examined it under a microscope, how much fat is in your stool, elastase, secretory IgA in the stool. I also get to see all the good bacteria, beneficial bacteria. Are you missing any? As well as beneficial yeast and fungi, and we're getting to the point where we can start to see viruses in the stool. And then same thing with harmful bacteria, yeast, viruses, right? So this is important because we know there's a huge link between autoimmune diseases and dysbiosis and leaky gut. So if we're not looking at the gut, we're missing a huge root cause for many of these patients with autoimmune diseases. The Nutri-Eval by Genova is very helpful because it looks through all of the antioxidants. It gives you a blood level and a urine level of all of the different vitamins, amino acids, toxins. How are the genetics functioning? Much more important to me than what genetics they have is how are the genetics functioning? And this is huge because we can customize multivitamins and amino acid supplements. And a lot of patients finally feel better when we get them on the nutrients they need in order to process correctly thyroid hormone and iodine in the cell, right? So it's a complex system, especially mitochondrial health involves B vitamins, carnitine, NAD. There's a long chain of vitamins and proteins and nutrients needed within the cell to make energy. So if you have someone and their main complaint of thyroid issues is weight gain and fatigue, you really need to look at the whole person. A lot of people do not magically feel better just because they're started on thyroid hormone. So that's when you would do more root cause testing. Heavy metal testing also can be essential. A lot of patients have had heavy metal exposures, whether it's mercury from food or water or dentistry, or arsenic from our food sources, or lead. And heavy metals, as you may know, are passed down from our grandmothers in the placenta. So when your mother was in utero, you were already an egg formed in your mother, right? So there's a lot of fat, lipophilic, fat-soluble heavy metals that are stuck to the placenta. And so we get a lot of our heavy metal exposure from our 2 generations ago. Salivary hormones also important because For example, with cortisol, which I'm going to get to in a moment here, you wouldn't want to send the patient to LabCorp 4 to 6 times in a day. It's just too much to do the blood work over and over. But you could have them spit into a tube 4 to 6 times in a day. So there's the convenience of doing saliva kits at home. But there's also the fact that when someone drives to LabCorp, their cortisol often goes up. Right. So if you can have someone do the testing in the comfort of their own home, there is a huge benefit to that. And then the full thyroid panel does include TSH, T3, free T3, T4, free T4, reverse T3, TPO, antithyroid globulin, and TSI. And that is a long panel. Now, I don't do all of this in every patient. For example, I don't often order reverse T3 if someone is not yet diagnosed with a thyroid disorder, because that's more helpful for me after we're treating them with medication. But I do certainly on all my new patients get TSH, T3, free T3, T4, free T4 for different reasons. The TSH, which we're going to get to in a minute, is made in the brain, not in the thyroid. So be careful. If you're only looking at TSH for thyroid treatment, you're missing a big part of the picture. A lot of patients do not feel better because their free T3 is too low. A lot of patients do not feel better because their free T3 is too low. Okay. And I often repeat thyroid panels morning and afternoon. I've started doing this more recently. Some patients feel great at 8 a.m., but at 3 p.m. they feel terrible. So have them go back to the lab sometime at 3 p.m. and just see what their thyroid looks like then. Some patients are on short-acting formulas like T3 only. And when they take it in the morning, that medication is pretty much gone. So they might need to take it again, or they might need to add some long-acting, some T4 or, compounded natural desiccated thyroid. Okay, so the ideal range for TSH is typically 1 to 2, although I will say some of my patients feel better around 0.5. There are no significant studies where we have shown that suppressing someone's TSH is dangerous in any way. There are studies of patients with Graves' disease where they have hyperthyroidism. Their free T3 is too high for many years, and this can cause bone loss, right? Can cause issues with the rest of the endocrine system if your T3 is too high. But that is not the same thing as patients that have low or hypothyroidism taking thyroid medicine. So be careful when you're interpreting studies not to extrapolate one thing for another thing. Patients with Graves' disease often have elevated T3 for quite a while before they're diagnosed with Graves'. Again, TSH is coming from the brain, coming from release from the hypothalamus, sends a signal to the thyroid. The higher the TSH, the better. Because if you have hypothyroidism before you're on medication, because that means that the TSH is really working. The brain is saying, make more thyroid, make more thyroid, make more thyroid. So for example, I've seen patients in here that have been diagnosed with Hashimoto's or autoimmune hypothyroidism, and their TSH was 12. So it was not 1 to 2, but it was 12, right? 15. I've seen 20. I've seen a TSH of 20. That's a good thing, though. It means the brain is doing what it's supposed to do. It is sending a signal to the thyroid to say, make more thyroid hormone. The thyroid, unfortunately, is not responding correctly, but we want the entire system. We want everything that could possibly still be working to be working when we meet these patients. If the person has no free T3, if their free T3 is 0 and the TSH is 1, that's a problem, because it typically means that the TSH has given up. So be careful because you need to get the full thyroid panel in order to really dissect what's going on with your individual patient. Okay, I think I talked about why we need to test. So T4 is more storage hormone, T3 is more active, free T4 is unbound, free T3 is unbound. So it is important to look at those just like we look at unbound DHEA, unbound testosterone, right? Those are important because bound hormones are not active at that moment. Reverse T3, the way I describe it to patients is that it is more of a liver issue, a gut issue, than it is a thyroid issue if reverse T3 is going up. Reverse T3 goes up to try to bind some of your T3 to slow down the release of T3 because your body thinks you're either overtreated or hyperthyroid. Now, the problem with that is if someone has a really sluggish liver or a leaky gut or dysbiosis, even worse in the gut, which is most of our patients, then their reverse T3 is also going to go up. And this is not on purpose. This is an accidental issue with the liver. And so we need to remind this patient to get the drain working, to get the detox working, to get off alcohol, to lower their stress, all the things that we know that help the liver to heal. Fortunately, it does heal. And the gut, make sure they're getting enough protein, enough B vitamins to heal the liver. And what then happens is as the reverse T3 comes down, they feel better because now they have more active T3, right? Sometimes I add on additional autoantibodies if I'm suspicious of autoimmunity, like systemic autoimmunity. The person has joint pain, the person has blood in their urine or protein in their urine. You know, the physical exam reveals specific autoimmune markers. They've got bulging eyes, they have very dry skin that I see, you know, nail psoriasis in the nails or lines in the nails, psoriasis on the skin. If they have a family history of autoimmunity, I also add autoantibodies. I like both books, Stop the Thyroid Madness, version 1 and 2. This is picture of the first edition, but the second edition is a white cover with blue writing, and that one's written more by clinicians for patients and clinicians. This one is written more by patients for patients. Both are valuable viewpoints. I got into this kind of medicine because I personally have Hashimoto's and I was not being cared for well, and no one would run a full thyroid panel on me, even though I didn't feel well, right? So I see the value in patients, educating patients, peer support, hugely helpful in this kind of medicine. And also the clinician book, the second edition, is great if you're a clinician who's just getting into treating thyroid issues. I also often check anti-adrenal antibody in my patients with low cortisol, as well as cortisol and DHEA. I like to do a 4 or 6 sample cortisol. It's always good to give people extra tubes. ZRT is a company that does this. LabCorp also does salivary cortisol. And it's good if they have extra tubes in case they wake up in the middle of the night, they can collect extra samples. The most important thing is they have to spit into the tube and they have to label what time it is. The Dutch panel by Precision Labs also gives us a full 4 sample cortisol. And that's great because it's urine. So if you have somebody with Sjogren's and they have very dry mouth, I give them the Dutch kit automatically. CAR stands for cortisol awakening response. And the beautiful thing is that if your cortisol goes up when you wake up in the morning to a healthy level and then comes down throughout the day, this prevents autoimmunity. It's this amazing, really fascinating endocrine immunology connection. This is why I don't like pulling one specialty out and not talking about the whole body all at the same time. If your cortisol goes up to a healthy level when you first wake up in the morning, within 30 minutes of waking up, you prevent autoimmune disease. Because every day, just like we're making malignant cells by accident, but the immune system's cleaning them up, we are making autoantibodies. And every 24 hours, there's a built-in cleanup system. Your body needs to see that cortisol rise in order for your immune system to go around and say, it's morning time now, let's go ahead and get rid of all those autoantibodies. I think that's fascinating, just the way that the body protects itself. The problem is we see patients 5, 6, 7, 8 years old, that young, who've already lost their cortisol awakening response for quite a few reasons, but especially people in their 40s. Women in their 30s and 40s have lost this cortisol awakening response for, because they've had insomnia, because they've had trauma, because of being new parents that have to go back to work with poor sleep for all different reasons. And what happens then is that they're prone to autoimmunity. So, yes, there's a genetic component, but the genetics may only be about 10% of this, and the rest of this you can control, but patients need to have this information. Okay, so here is a graph of what's happening, or a drawing. The hypothalamus in the brain is releasing thyrotropin releasing hormone, or TRH. The anterior pituitary gland is actually the one releasing thyroid stimulating hormone. There's a negative feedback loop, which means as soon as the thyroid makes enough T3 and T4, the hypothalamus will slow down the production of TRH and TSH will come down. So if you have someone on enough T3 and their free T3 level is sitting at 3.2, their TSH should come down from 12 to 1. It's an excellent way to look at, is the system working correctly? The problem is you can't pull out the TSH alone and say that that is evidence that the thyroid's working correctly, because the feedback mechanism may be broken, especially after many years of not getting enough thyroid hormone. Okay. We know that the increased thyroid hormone causes a little bit of a catecholamine effect. Patients feel terrible when they're overtreated. No patient will continue to take too high of a dose. So there's very little potential for abuse. I don't know why, but providers are often very worried that patients will abuse their thyroid hormone. But if you've ever taken too much thyroid hormone or been overtreated, you know how terrible it feels. It feels like constant anxiety. It's not a good feeling, right? Okay, we've already talked a lot about this. Most important thing here is that T3 is active. The conversion happens in the liver and peripheral tissues. Reverse T3 gobbles up T3 to slow down the metabolism. This is on purpose, but it doesn't always work right. TSH, pituitary, TRH, hypothalamus. So remember that these are not thyroid hormones. Here's another way of looking at this feedback loop. The hypothalamus here talks to the pituitary talks to the thyroid hormone, some of it goes into peripheral tissue, some of it goes into the liver, and then it's released to the bloodstream circulatory system, as well as conjugated and circulated throughout the intestine. So like, here's where if you don't have enough thyroid hormone, you're not going to have peristalsis of the intestine. And these are the patients that are addicted to Miralax or Senna, and they are really struggling with constipation. And guess what? Constipation then backs up the liver, right? Because you're not able to get toxins out of the stool, and then the liver takes on a heavy burden. So do the lungs. You end up with a long list of other issues when you have chronic, lifelong constipation. Okay, so yes, most cases of thyroid issues are autoimmune, although honestly, since I made these slides, I would probably change these numbers. I'm seeing more and more patients that do not have autoantibodies. They don't have TPO, they do not have antithyroid globulin antibody, and they have low thyroid or functionally low thyroid. But if you see those antibodies, you know that typically TSI, or thyroid stimulating immune globulin, is associated with Graves', and typically TPO is associated with Hashimoto's. Many autoimmune conditions are seemingly unrelated, so you really need to dig when you're asking a history. Patients do not realize that type 1 diabetes is different than type 2. They don't realize that rheumatoid arthritis is different than osteoarthritis always. So you need to ask a lot of questions about family members that had diabetes, that had arthritis. Lupus, most patients know that's autoimmune. Sjogren's, if they've heard of it, they usually know it's autoimmune. A lot of people know that MS is autoimmune. They don't realize they can prevent MS, however. Different conversation for a different day. These are some rarer things, but to be honest, if you start asking a lot of questions, you will meet more and more people with dermato or polymyositis. It's just underdiagnosed. Same thing with relapsing polychondritis. This is underdiagnosed. It's supposed to be a very rare autoimmune condition. I'm seeing more and more and more of it. The rheumatologists often are not able to help until the disease gets really bad because they're limited in terms of the tools that they have. Autoimmune hepatitis, I'm definitely seeing more and more of this. Some type 2 diabetics also do have an autoimmune component, so you need to ask more questions about family history and of the patient. We think maybe Alzheimer's is autoimmune. We think PCOS is autoimmune. We think autism may be autoimmune. There's more and more that we're discovering. So we may benefit. This is just me adding my 2 cents. We could benefit if we studied all autoimmune conditions together instead of separately. So, and that's because a lot of times the root causes of malnutrition or dysbiosis, poor absorption of nutrients, increased toxin load, chronic infections, defective cortisol responses or low cortisol in the morning. All of this is prevalent, and all of this has to do with autoimmune conditions. I also see more patients who are type A personalities, who try to do everything, who never say no to anything, who develop autoimmune conditions. I don't know if it's because of this principle in Ayurveda of self-care, of like slowing down and knowing that you are enough, and that emotional mental health shift actually helps you become healthier. I certainly see people who got a hold on their health only after pregnancy because that was the wake-up call they needed. But I wonder about this link. I'm just curious. What is this link between type A personalities and autoimmune disease? See if you start to notice it too. And then how do we get to the root cause of autoimmune disease? I mean, that's a long conversation about, what we call in functional medicine triggers and mediators and antecedents. We call the matrix, when you do a timeline on someone or a really good history at a new patient visit, it involves everything from where you breastfed, where you vaginal delivery in terms of your gut health, what kind of foods did you eat growing up, what kind of traumas did you have growing up, strep infections, Epstein-Barr infections as a child, quality of your sleep, were you snoring throughout childhood? So we need to dissect things one at a time and get to the root causes. I know a lot of my patients with thyroid issues definitely have dysbiosis and imbalance of the good and the bad gut, and they've had gut issues or digestive issues as long as they can remember. We know that in this country, within 5 years of getting your first autoimmune disease, you will get a second. Those are the statistics. So I tell patients that because they need to know, why is it worth it to do the detox work, to do the inflammation work, to change their diet, to change their lifestyle, to start doing yoga, to find a less stressful job. They need to know why. Why is it worth it? It's a lot of work. It's a whole lot easier to just take the methimazole pill for Graves' disease than it is to get to the root cause. I recommend the book Root Cause by Isabella Wentz. It's a wonderful book. She talks about how 10 years before you have full-blown Hashimoto's, you do probably have thyroid antibodies in most cases. There's time to reverse. A lot of my patients that I meet have not been dealing with this for so long that it's too late. Also, it's never too late to prevent the next autoimmune disease. Aviva Ram also has wonderful questionnaires and information on leaky gut and detoxing. Okay, and then here's kind of the crux of the thyroid-adrenal connection. So when thyroid disease is not an autoimmune disease, so when this person comes to see you and they have low T3, low free T3, low T4, low free T4, any of those or all of those, and they don't have thyroid antibodies, but their cortisol's off, their DHEA is off, their pregnenolone is off, that points to adrenals as the root cause. Why are the adrenals shot? Because they've had Epstein-Barr virus for 40 years, because of stress. And sadly, some patients cannot articulate where their stress is coming from because they've kind of buried it for so long, right? It's really, there's a stigma around people talking about their issues. I see patients on either end of the spectrum in terms of like, my life is so stressful, it's awful, and versus people balancing amazing things and they don't see how hard that their life can be, right? So this is where therapy is helpful. Joe Dispenza has excellent work on how our thoughts create our emotions and our emotions create our actions. So having people read about where these emotions come from, where their examples of how to manage stress have come from. I know personally growing up in a family with Type A personalities combined with addiction. I didn't see a lot of healthy coping mechanisms for stress. And I don't think I'm alone. But yes, chronic infections. I would add strep to this list, or other chronic infections. Mycoplasma can even cause it. Lyme can cause thyroid disease as well as adrenal dysfunction. Don't forget that someone might have had surgery to remove part of their thyroid. Some patients have had pituitary tumors, which are affecting the body's ability to make the TSH to trigger the thyroid hormone to be made. There is something called Wilson's temperature syndrome, which usually is chronic stress, chronic low body temperature caused by low T3. Patients can address that by taking T3 by itself. They can take T3 up to 4 times a day and check their body temperature and their pulse and make sure that this is getting better. The idea with taking the medication, even if it's only part, short term, is to give the endocrine system some time to heal. So I've seen patients that were making no cortisol. I gave them hydrocortisone for 6 months to 2 years. Their adrenals rested and they were able to then come off the medication and make cortisol again. You don't want to give them too much. You want to give them the correct dose that physiologically they would be making, and then correct the underlying cause, correct the lifestyle issues, get them eating healthy omega-3s, treat the Epstein-Barr, treat the HIV, whatever is going on. And then, of course, remind patients that everything's connected. Try to talk to them about how the adrenal glands and the thyroid are connected. Maybe we just don't know that there are additional thyroid antibodies. Maybe when we're checking TPO and antithyroid globulin for Hashimoto's, where that's not enough, maybe there's additional ones we're going to discover. The immune system, the data and the information that we have on the immune system now is different than it was 5 years ago, different than it was 10 years ago. It's changing as we study more and learn more. And then if the thyroid is the engine, the adrenals would be considered the transmission. So obviously, if there's an issue with the transmission, it's going to burn out the engine. I see that over and over. Patients think the primary issue is their thyroid. It turns out it's not. The primary issue was their adrenals. Okay, just a reminder, here's the picture again. Hypothalamus talks to pituitary. Here, the arrows are going to the adrenals, but there is an arrow back here to the thyroid, which is not pictured in this picture. Why do we see so many people who are so stressed? I think that's a complicated question with a complex answer. I definitely see people who are older when they have their first child. This can be harder on the body than having a child at 25, 26, 27. It can be harder to have a child at 40. More focus on continuing their career. There's a lot more women having children, and they are the breadwinners in their family, and they go back to work pretty quickly. They're not staying home for 2 years. People do not have a tribe to lean on. They don't have, an aunt and a grandmother who lives with them to cook dinner for them when they're recovering from having a baby. There's also a whole lot of undiagnosed post-traumatic stress. This only got worse during the COVID pandemic. The thing about PTSD, though, is if you can help a patient name it, it usually is a source of relief to realize that something happened to make them feel how they're feeling. So whether it's somebody who served in the military, or someone who had a traumatic birth, or someone who had a blood clot after COVID, if you can talk them through, hey, that thing happened that was outside your control, there's a lot of psychological manifestations that are going to come up. This is a process. This is a journey. You're allowed to grieve. You're allowed to have time to heal. There are people and therapists who can help you. And if you're not into therapy, you can try meditation. You can try the Serenity Prayer. There's so many things you can try. But I think sometimes in the office, even if we don't know how to treat PTSD, if we can help people name it, it gives them a little bit of a release where now they can research it on their own time. They can learn about therapy. It takes some of the stigma out of it if we're able to talk about it. A lot of people have had trauma in childhood that's caused PTSD. There are men who are more isolated socially than women that I see in this clinic. Men in general, are relying on their spouse, if their spouse is a woman, to create a network, a social network. And that's not always the social network they need, right? Because if you're having someone else choose your friends for you, they may not always be the best friends. So I encourage men especially to have a tribe, to have people they can talk to. Do they have a colleague? Do they have a neighbor? Do they have somebody that they could get to know on a little bit deeper level? Because we know that our mental health is so related to our connection to other humans. Screen time, I think, can really do a number on our adrenal glands. If you get home from work and then as you're cooking dinner, you pop on the TV, and then as you're going to bed, you're watching more Netflix or playing video games, or it just doesn't allow your brain to relax. The blue light, really affects the ability for you to get into delta sleep waves or brain waves at night. And this in turn creates a situation where you don't make enough cortisol the next morning. I think news being sensationalized and available 24 hours a day, I think social media, I think looking for quick fixes, even in integrative functional medicine world, I still see patients that are really looking for a magic pill. Even yoga every day, if you're only practicing the yoga 1 hour a day, but you're at work for 11 hours and it's very stressful, even yoga can't fix that, right? So how can we fix this? How can we prevent future adrenal fatigue or adrenal dysfunction, future thyroid imbalance? I think we have to do some hard work in our entire society addressing the underlying causes. Basics. I say to people, you need vitamin C. Your adrenals are supposed to be saving vitamin C from your food that you eat. You don't make vitamin C. You have to get it from the food you eat. Are you eating any vitamin C? If your adrenals are tanked, you need to take some additional vitamin C. Same thing with Himalayan sea salt. If the person is urinating frequently and the urine is very dilute, that is a sign that they need more salt. Salt has gotten a bad reputation, but I have especially a lot of female patients who are postpartum who need more salt, and they've been paranoid to eat more salt or take more salt. It's really essential to help the person get hydrated earlier in the day. And if your cortisol is a little bit low, it can help you feel much better earlier in the day to get enough salt with your water. Things like Adrenal Cocktail by Jarrow are great because they have sodium, potassium, and vitamin C in them. Sleep hygiene, we go through a whole handout on what are you going to do before bed. Make sure the room is cool enough, no TV in the bedroom, put the device down 2 hours before bed. Stop trying to do it all. Stop saying yes to everything. This fear of missing out is what's killing you. And then, of course, your food is going to affect your health. There's a Chinese medicine saying that he who eats processed foods, or he who does not eat healthy, wastes the time of the physician. And I really like that saying because number one is look at what you're eating. Are the foods a variety of color? Do you know what helps you feel good, right? Forget the fad diets and just look at your plate. How many things on that plate grow from the ground? The brighter colors have more antioxidants. So like for me, if I eat blueberries, I notice within a couple hours that I feel better. If I skip blueberries, I notice that I have less energy. It's just something I've noticed about myself over the years. So ask patients to keep some logs and keep track of what they're eating and notice how they feel. Healthy fats. I already mentioned enough protein, enough leafy greens, enough vegetables. Keep in mind that the soil has been depleted. So 40 years ago, we could eat a cup of spinach and get enough iron. Now we need to eat 3 cups of spinach. Same thing with magnesium. Same thing with potassium in a potato. Potatoes are actually a great source of potassium. Why is it lower now than it was 40 years ago? The fields have been over-farmed. The sodium's been depleted of nutrients. Sorry, the field has been depleted of nutrients. So look at the food, Make sure that you're eating what you need. I don't like extremes when it comes to food. Just a balanced diet, always the Mediterranean diet. Plenty of fruits and vegetables is going to be the healthiest thing. We need the fight or flight. Remind patients that you do need some cortisol or you're going to die. Cortisol also gets a bad reputation on social media. Cortisol staying too high is not great. Sometimes licorice root can really help there, turn cortisol into cortisone so you can detox. Same thing with estrogens. We need to be able to detox from the estrogens every month if you're a woman. Adrenal fatigue is also an old term because we don't see patients go into low cortisol and stay there. We see patients, sometimes it's high, sometimes it's low. It's dysfunctional. So the better term is adrenal dysfunction. We need to help support the body to come back to homeostasis. And then talk to patients about what happens when they lay down to go to sleep at night. Did they get a second wind? Is that because they waited to go to bed too late? Is that because there's things that they need to try to implement an hour before bedtime, like some holy basil tea or some deep breathing? Is their mind racing, or is it like a physiologic response where they feel like they're wide awake? If they're having a cortisol spike at bedtime, what can they do with herbs and adaptogens, but also with their environment to just get the bedroom to feel like a safe place? There are patients who've had so much trauma and different types of trauma, they don't have a place where they feel safe. So that is number one. And then self-care, which we'll come back to. So the blue line is what the cortisol should be doing. Every morning you should have a bump in your cortisol. And then midday it should start to drop. And then by evening you should be ready for bed. You should feel sleepy. This red line is what I see a lot of patients' cortisol doing. This is where they're having more coffee, more caffeine. This is where they're super stressed because they have to pick up the kids and make dinner and do all the things, and they already worked a full day. So if this is happening and they're not getting that spike, that cortisol awakening response in the morning, they're not preventing autoimmune disease. And they feel pretty lousy in the morning, their brain's not working. The adrenal glands, as we already mentioned, are talking to the thyroid. So the adrenal glands directly, if cortisol goes up, will slow down thyroid hormone production. I think that's huge because that's what so many of our people are experiencing. If cortisol goes up, it will slow down thyroid hormone production. Why? Because that thyroid hormone surge helps increase catecholamines, helps increase epinephrine, norepinephrine, stress hormone. This is a good thing in moderation, right? We want to be able to stay awake and have our brain work. However, over time, many, many, many years of high cortisol, you're going to burn out your thyroid. We also know that the adrenal glands can modify how much T4 is converted to T3, so they can decrease it. They can create thyroid hormone resistance. They can also create a shortage of unbound thyroid by binding thyroid hormone. So prolonged cortisol elevation can also cause an excess of estrogen to accumulate. Most patients do not need a sudden increase in their estrogen for various reasons. Estrogen, progesterone, testosterone need to be balanced. A lot of our patients need more progesterone and more testosterone, not more estrogen. And then the adrenal glands also suppress the immune system. So that's interesting because if you're really stressed and you get exposed to Epstein-Barr virus and you get really sick, that in turn can affect the thyroid gland. There's a portion of the genetic code of Epstein-Barr virus that looks just like the thyroid. So after time of the immune system fighting the Epstein-Barr, it will turn on itself and start fighting the thyroid. We know that when patients are born, if they have like congenital thyroid issues, that can be considered a midline defect. You are more likely to have a tongue tie if you have an MTHFR mutation, or polymorphism is the correct term. We know that the fetus relies on the mother's production of thyroid hormone until he is making his own thyroid hormone. So the first 12 weeks of pregnancy, if the mother's thyroid hormone is low, it can lead to mental retardation or spontaneous abortion. This is proven over and over again in the literature. This is why women in the first 12 weeks of pregnancy must have a full thyroid panel done as often as they need it done, right? So every 3 weeks, if they need it, if they're feeling nervous or if their thyroid's feeling low or if they're not sure about the safety of the pregnancy, right? Polymorphisms can be expressed or not expressed. You can eat healthy for 7 years and turn on and turn off some of these things. So I want to point that out because people often talk about genetics like they are permanent, and they are definitely not. Epigenetics is something that we've understood now for 10 years and longer in some areas. But we've been talking about it for at least 10 years. And so if you can convince your patients to create a safe space in their home where they're not constantly being stressed, where they're getting good quality sleep, where they're eating healthy, you are going to turn off some of the genes that they may have that are predisposing them to detox issues, methylation issues, Alzheimer's, MS. So if you can give the patient this information and empower them, I think it's really freeing as the patient if you have that information, you know? Postpartum thyroiditis is huge. It's very, very prevalent. It's about 7 to 11% of mothers. Symptoms are anxiety, insomnia, hair loss, weight loss, irritability, labile mood. This is not the baby blues. The baby blues is done within a week. When mothers at 2 months postpartum complain to their providers that they don't feel well, they need to be heard. Someone needs to say, I hear you. Do a PHQ-9, a depression screening, also check a full thyroid panel. Symptoms at 4 to 8 months can be weight gain, fatigue, constipation, depression, decreased milk supply. You know, a lot of this, the mother will report it to their provider and nothing is ever done. There's not a full panel of hormones or thyroid done on this patient, which is really, really a shame. Postpartum thyroiditis can also be diagnosed on symptoms alone. People can have both hyper and hypo symptoms. 80% of women, the symptoms can resolve. You can taper off thyroid medicine if you were hypo, but 20% will have a long-lasting Hashimoto's. So let's look at 1 out of 10 of our postpartum moms, make sure that we don't miss the postpartum thyroid disease. It's a game changer when it comes to starting your career, if you will, or your new job of being a parent, if you feel good versus if you feel terrible. So how do we heal the adrenals, and how do we heal as a society as a whole, because we all have fried adrenals, right? Avoid caffeine to the best extent that we can. You know, order a decaf if you really love how coffee tastes, or tea in the afternoon. Try to get a decaf. Go slow. You don't have to do all or nothing, but certainly cutting back makes a big difference. I tell my patients, if you could get 100 milligrams of caffeine or less a day, I can probably heal your adrenals on that. I don't need everybody to go to 0. Some people do, though, need to go to 0, at least for a short period of time. Biofeedback, yoga, anything to help the tone of the vagus nerve, anything to activate the parasympathetic, the rest and digest. I tell my patients that the goal is for you to be in parasympathetic or rest and digest 80% of the time that you're awake, 80% of the day. So what do we need to do to get you there? Do you need to consider sending resumes for a new job? Do you need to outsource right now, ask for meal delivery or grocery delivery? Or, you know, we are living in this modern world with all these conveniences. We've got automatic washers, dishwashers, and clothes washers. Oftentimes, children are not being given enough chores or being asked to help enough in the home. A lot of my, and I know I'm generalizing, but a lot of my female patients are trying to do everything instead of asking for support that they need if they're working, especially if they went back to work because they're the breadwinner in the family. They should not, it's not healthy to be trying to do it all. And then no naps. You know, it's interesting. Some patients will tell me on the weekend they'll fall asleep at 2 o'clock and sleep 4 hours. And they're like, oh, I felt amazing. Yeah, but you know what? Your cortisol awakening response is going to be really unhealthy the next day. In general, the nap time is 15 to 20 minutes. You can set a timer. You can sit in a chair and take some deep breaths and close your eyes. But I don't want people to take 2 to 4 hour naps in the afternoon. I already mentioned vitamin C. You can even push people's doses up. If you're trying to treat Epstein-Barr or cytomegalovirus increase the vitamin C doses. 1,000 milligrams a day or 1 gram all the way up to 9 grams a day. Sea salt for low blood pressure. A lot of our patients with low cortisol have low blood pressure. Sodium, magnesium, potassium, you can make it yourself, cheaper than ordering it. DHEA will suppress cortisol, but also helps increase sex hormones. DHEA imbalances will also cause acne. Patients are thrilled when you tell them, I can do a blood test to see what's causing your acne. So order DHEA in the blood testing or in the saliva or urine if you're doing the Dutch kit. Melatonin will suppress cortisol. So if someone has a very high cortisol in the morning, that means they probably need more melatonin, or if they have a very high cortisol at bedtime, even better, then they need some melatonin. You can do melatonin over the counter, or you can give them the precursors they need to make their own melatonin. B6 or P5P, L-theanine, and GABA are all needed to make melatonin in the brain. Also, bright light in your eyes. So going outside without any glasses on first thing in the morning will help reset your melatonin, so you'll make more melatonin 12 hours from then. So if you go outside at 7 a.m., you'll start making more melatonin at 7 p.m. Wonderful. That's how it should be. You can't make melatonin through the car window or through the windows in the house because they have UV coatings on them now. So you need to get outside, actually outside, not sitting in the window. We may, in some cases, have to address the adrenals before we can fix the thyroid issues. Sometimes we have to do it at the same time, but sometimes the person has a functional low hypothyroidism. They have no Hashimoto's, and the issue is actually more because they have no cortisol. They've essentially burned out from making so much cortisol for so many years. They're not making enough anymore. Chapter 2 in version 2 of Stop the Thyroid Madness talks about this, about the adrenal thyroid connection specifically. Okay, intermittent fasting can be great when people have elevated blood sugar. People are overdoing it though, and women are not small men. So women should not be doing extreme fasting during the luteal phase. They can fast during the follicular phase, but when they ovulate and go into the luteal phase of their cycle, they need to eat what they're craving. So more carbs, more protein, more salt during the luteal phase. This is proven in the research. There's really good information out there. Dr. Stacy Sims is the nutritionist who did a lot of the research. She's great. She's a triathlete. She knows how to fuel her body based on her hormones. Some men should also not fast because they really need to sit, to have food in the stomach to calm the vagus nerve. There are men who are kind of addicted to fasting, and it feels good because it's increasing some stress hormone, but that's not a good plan long-term if you already have elevated cortisol. So all advice is not for everyone. And sometimes podcasts are very generalized, and patients will come in having listened to a lot of them. And what I say to patients is, okay, that's great. Send me that podcast. But I'm going to tell you, based on your labs and based on the hour to 2 hour long intake visit I did with you, that I'm assessing you this way. So there's a reason why right now I don't want you to fast. Sometimes I give people the go ahead to fast 14 hours, 16 hours, and then eat during these shorter windows. But sometimes I explain to them why I don't want them to fast. Everybody's an individual. I already talked about the blue light and the delta waves. EMFs, electromagnetic frequencies, are all in our environment with Wi-Fi, with cell phone towers, with us talking on Bluetooth in the car, which actually increases your risk of brain cancer. So there's a lot of research going on right now about EMFs in our schools, EMFs in our bedrooms. Do everything you can to discharge from the pollution, essentially, that your body's been exposed to. So you can ground in the earthing, go walk outside barefoot if you have a spot that's got just dirt. You can sleep on a grounding mat. You can take your phone certainly out of your pocket or off your person. This is all on our sleep hygiene handout, which I can share with everybody. Send me an email if you'd like a copy of that. And then look for, decaf coffee. Look for mold-free decaf coffee, Swiss water, not chemically extracted. And remember that when you're drinking a lot of caffeine, you are definitely borrowing energy from tomorrow. So it's not a good long-term fix. I think most people know that already. And here I said 200, but a lot of times I tell people try to get it down to 100 milligrams per day or less. These are all treatments for adrenal dysfunction. Holy basil is great. It can be, if people like the smell of the herb, then it's probably more likely going to help them. Rhodiola, I often give in the morning because it will help increase, for a lot of patients, it increases cortisol in the morning and helps with brain power. Schisandra is also helpful for liver support. So if you have someone that has non-alcoholic fatty liver disease, that's a great one to start. Ginseng can be great for patients with ADHD and adrenal dysfunction. Oat seed, skullcap are both excellent for patients with anxiety and adrenal dysfunction. Ashwagandha helps in men with low testosterone and adrenal dysfunction. So what I do is I look at the adaptogen or the herb and I try to match it with what the other things I know the patient has going on. If you're a 40-year-old man and I know you're free and your total testosterone are low, I'm going to start you with ashwagandha. If I know your cortisol is off and your testosterone is low, great, it's going to help with both. St. John's wort, as we know, can help with mood. So patients that are more depressed and have low cortisol. Kava, again, helps with anxiety as well as cortisol. Licorice helps with clearance of high cortisol, but it can actually help people that have low cortisol feel better too. Licorice, you also do need to be careful in some patients with elevated blood pressure. So if you're going to start these herbs, learn them one at a time and just go through and try to learn what are the best doses, best formulation capsules versus tinctures. Eleuthero can be great because it's a very gentle kind of like natural ginseng. That one is actually in Dr. Salibi's book. My mentor wrote a book called Wonder Herbs Guide to Adaptogens. CBD is interesting. It's kind of expensive compared to a lot of these other herbs that are more affordable. But for some patients, CBD before bedtime can be hugely helpful. Phosphatidylserine is spelled wrong here, but same thing. Phosphatidylserine can be very helpful at bedtime to lower cortisol throughout the night. Phosphatidylserine is great for our patients that really insist on exercising after work, even though we don't really want them to go to the gym at 6 p.m. They're doing it, their cortisol is going up. I say take a phosphatidylserine afterwards. It helps lower cortisol to get them a good night's sleep. And then manage inflammation to help heal the adrenal glands. We know that tyrosine, taurine, L-theanine, 5-HTP, all of these actually help heal the HPA axis by helping get better sleep, lower anxiety. Be careful because there's some interactions, especially with GABA and Lexapro and Prozac. We know that L-glutamine boosts growth hormone. This helps people sleep, helps the quality of their sleep. Gut healing tends to also help with the adrenals. I think if you're breaking down your food and digesting your food better, you can now absorb all these precursors for happy neurotransmitters. If I'm happy and I'm in a good mood, I'm also less likely to reach for extra caffeine or extra, something that would drain me, like sit around and watch a whole Netflix show and expose myself to that much screen time. I like giving patients information on how to eat for their mood. So what I mean by that is when people are depressed, a lot of times they do need more omega-3s, more anti-inflammatory fats. They need more colorful foods, bright blue. Blueberries are so helpful. And so remind them that neurologically, the things happening in the brain with their mood connected to their gut health and connected to the hormones, the health of the hormones of the rest of the body. What does a full treatment plan look like? So a patient comes in and they tell me that they've been diagnosed with Hashimoto's thyroiditis. And I say, okay, great. You already have that diagnosis. Let's get a full workup. I'm going to order DHEA, cortisol, iron, because low iron can mimic signs of low thyroid. Same thing with selenium. Low selenium can make you feel like you're low thyroid, even if we've got you on the right medicine. Magnesium is huge because it's involved in hundreds of different detox reactions. Some patients have chronic migraines and hormone issues until we get them on magnesium. Some patients really need a magnesium supplement. It's the #1 supplement that patients need. Iodine, some patients have, like, their thyroid hormone looks okay. It might be a little borderline low, but their iodine is low. And that's really important, especially patients that have had COVID. COVID destroys people's iodine stores. That's because iodine is anti-COVID. So get them to use a povidone iodine nose wash when they have COVID and kill the COVID that way. And then also nascent iodine drops in their water, hugely helpful after COVID. Again, zinc copper balance is really helpful. If someone feels really anxious, but their thyroid is already treated well, we don't want to bump up their thyroid dose because they're going to feel more anxious. So is their zinc low? The #1 thing I see in my patients with anxiety is their zinc is too low. And then a full thyroid panel. Gut healing, I've already mentioned why it's important. Make sure estrogen, progesterone, testosterone are all in balance. You will feel better if your progesterone, estrogen, and testosterone are all a tiny bit low than you will if one of them is high and 2 of them is low. So you need to look at that for cycling people a couple times during the month. For men, you can get first morning testosterone, but you could also get it at like 5 p.m. just to see the difference. Testosterone should be highest when they first wake up. Good vitamin D level, which may prevent autoimmune disease, and magnesium. We need magnesium in order to absorb the vitamin D. So usually before I put people on a vitamin D supplement, I am looking at what is their magnesium level. We already talked about how food is medicine. I try to get people to get 2 hours of deep sleep. I know that's asking a lot. Maybe that's the type A part of me that won't die, but 2 hours of deep sleep a night would be great. A lot of people are getting 45 minutes. Some people are getting REM and they're making up for lost sleep by dreaming a lot, but they don't feel rested when they wake up. And that's because they're just not sleeping for long enough, or they're snoring, or they have soft tissue swelling of the back of the throat. They've got chronic fungal infection or an issue with their tonsils, and they're snoring or having sleep apnea, and they are not getting into a deep sleep. That's a big problem. We can do all of these other things, but if your sleep is not quality sleep, it's really hard to heal someone's adrenals and their thyroid. Stretching, just in general, feels good, helps people to prevent injury. Stretching, I try to not talk about yoga or pranayama or breath work too much because it intimidates people. It's so simple though. Every single day, we need to stretch and we need to breathe. If you can take a few deep breaths, you're beating the average. The average American doesn't even take 1 deep breath a day. But the power of taking a deep breath, of like feeling your ribs expand, is huge. It's very healing. So I try to talk people through that at the beginning of every visit. And then figure out what is driving inflammation. Why is there chronic inflammation? Why have the adrenals been burnt out? I already talked about a lot of this. And then here's my sources. I hope that was helpful. We're always doing more classes at our center online. A lot of times they're live with a Q&A. So feel free to email us or to follow our YouTube channel if you're interested in more information. Thank you so much.